So we're going to talk about infants, neonates and infants in terms of development. We'll begin with physical development, but you really need to understand the social and cognitive development as well. So first, some general trends in growth and development. We've talked about these several times, but remember that growth tends to be cephalocaudal, so top down, proximo-distal from the in to the out. And it also tends to be bilateral and symmetrical. So if we have development on one side, we have development on the other side. Development also tends to be from simple to complex. And you'll remember that from fetal development. We start with very simple, a very simple form of the organs, and eventually those differentiate and become more complex. The same thing happens with behaviors. The infant develops simple behaviors first in isolation, and then they begin to combine those behaviors into more complex behaviors. Development has a fairly predictable sequence. Every child develops at their own individual pace, but typically they do A before B before C. There are a couple of exceptions here and there, but typically the sequence of development is fairly predictable. There may be a difference in the pace of development among systems. Sometimes kids will seem to focus on one area of development at a time. An example of that might be they don't learn any new words for 2 or 3 weeks while they're really working on learning to walk. And then they get walking down, and then they start maybe learning some more new words. So sometimes they seem to be focused on one area of development, and then other areas catch up. There is a theory that there are sensitive periods, and that's a time when development in a particular area is critical. And if that time period is missed, the development in that area gets really difficult afterward. Also remember, we're talking about averages and generalizations. There's a lot of variation in what's normal, and each individual child develops at their own individual pace. So some physical growth and development in the first year. Birth weight mostly reflects the intrauterine environment. So at birth, what the baby weighs usually has to do with some with the size, but also with the health of the mother. Okay. After birth, infants will find a weight gain curve that's mostly determined by their genetics. So a child may be born large, but they're maybe just genetically going to be a smaller kid. They may actually drop a couple of percentile or curves, but then they find their curve and they grow on that curve consistently. So it's not unusual to see kids crossing those growth curves right after birth because they're finding their weight gain curve. In general, birth weight is doubled by 4 to 7 months, tripled by the end of the first year. Height growth is faster in the first half of that year. It's about an inch a month. In the second half, it slows down. It's about half an inch a month. Usually, birth length has increased by about 50% by the end of the first year. So a child that was 20 inches at birth, probably about 30 inches tall at 1 year. Head circumference, again, grows faster in the first 6 months and then slows down some in the second 6 months of life. The respiratory system, we're going to talk a little bit about systems first. The respiratory system, kids are still predisposed to respiratory infections in that first year of life. All the structures are closer together. So if they get an infection in one place, it doesn't have to go as far to get to the next. They have smaller airways. They have short, straight eustachian tubes, so they are prone to ear infections. And they have a slower immune response because their immune system is still really learning how to function. So respiratory infections are more common in the first year of life. The cardiovascular system, remember the fetal heart rate is 110 to 160. That's newborn heart rate should be somewhere in that range, and then it gradually shows through the first years. There's something that's common in children called sinus dysrhythmia, where the heart rate increases with inspiration and decreases with expiration, and that's a normal variation. The hematopoietic system, remember that fetal hemoglobin is a little bit different from adult hemoglobin. Those red blood cells with fetal hemoglobin break down faster. Over the first half of infancy, the first 6 months of life, that fetal hemoglobin is gradually replaced by adult hemoglobin. Around 3 to 6 months, there's a physiologic anemia. Fetal hemoglobin suppresses erythropoietin, which promotes red blood cell development. So as its red blood cell formation is kind of suppressed until enough of those fetal hemoglobin cells break down and the hemoglobin falls, and that actually triggers erythropoietin production and increased hemoglobin or increased red blood cell production. Infants are born, if they're full term, with iron stores for about 5 to 6 months. The GI system, the metabolic rate is very rapid in infancy. They metabolize quickly. They also don't have very big stomachs, so they eat frequently. They can't eat 3 meals a day. They've got to eat every 2 to 3 hours as newborns, and that gradually spaces out. Nutrition is the greatest influence on growth in infancy, so we really need to give them good nutrition. The digestive system is immature. So human breast milk or commercial iron fortified infant formula are the only appropriate things to feed a child for the first 4 to 6 months. They don't need anything else in addition to that. And we're going to talk more about that later. Again, small frequent feedings are needed at first because their stomach capacity is small and they have a high metabolism. So they need to eat frequently. Immunologic system. Newborns have some immunity from the placenta. They've got some of the mother's antibodies have passed through the placenta. If they're breastfed, babies continue to get antibodies from the mother as long as they're breastfed. Breast milk contains prebiotics that promote normal intestinal flora. So the immune system itself actually responds slowly in infancy, so they may not have severe symptoms until later in a disease, and they tend to get sick quick. Vernix caseosa may have immunologic properties, and it may promote normal acid-base balance in skin flora. So we don't scrub all the vernix off, we leave it there. So we need to protect those kids from infection because they're greater risk for infection. Thermoregulation for about the first month is kind of spotty. They need about 1 more layer than we do. After the first month, it becomes a lot more effective. Renal system, in the first year of life, the kidneys really don't concentrate urine well. And what that means is when you start to get dehydrated, your kidneys get hormone messages to hold on to water. So your urine gets more concentrated and that water is pushed back into the bloodstream. Newborn kidneys don't do that very effectively in the first year of life, which means 2 things. They're at greater risk for dehydration, but also if they have decreased urination, they are very dehydrated. At birth, 75% of the infant's weight is water, and that decreases through the first year. So that high water content in immature kidneys means that babies are more easily dehydrated. The musculoskeletal system, the bones are not completely ossified. And if you look at an x-ray of a baby's hand, you're going to see big gaps between the finger bones because they're not completely ossified. That's true of all the bones. That means fractures are actually less likely, but their joints are not as stable. The neurologic system, growth is more rapid in fetal life of the neurologic system, but it continues to be rapid through the first year. So brain growth just gradually slows down over that time. Newborns have a very high sleep requirement. They sleep maybe 21 hours out of 24. That sleep requirement gradually decreases, but even in a year, they should still be sleeping a large part of the time. They have longer wake periods during the day, but they should be sleeping quite a lot, even at a year. Visual acuity at birth, a newborn can see about the distance from if you're holding them in your arms to your face, okay? Their visual acuity improves through the first year. They don't have depth perception until about 7 to 9 months. And the really interesting thing about that, the way they did that, they established that, They used something like plexiglass and they put it over a visual drop, and they had the infant crawling. And before they develop depth perception, they'll crawl straight across that. When they're able to see the drop, they won't try to crawl across that. Okay, so that's the end of this section, and we're going to talk about developmental theories in the next.